also has like zinc and other nutrients that can help in motility of the sperm so that it will get to the egg and fertilize to basically help fertilization and reproduction basically. So it also has some sort of like a valve kind of nature since it's surrounding that opening, so it can also help to like urinary control. Yeah, so it's a very important gland and for men. Yes.
Okay,
Yeah.
so whenever we talk about men's health, prostate gland or anything related to the prostate is one thing that always comes up. I mean, one of the leading causes of death in men when it comes to diseases is prostate cancer. So I'm wondering, why is the prostate gland susceptible to diseases? What makes it vulnerable? It's just like I'm thinking now in comparison to the woman's body, the mammary gland, her breast is one thing that is always like it's easily susceptible. Breast cancer is one of the leading causes of death when it comes to women. Why is the prostate gland that susceptible?
Okay, so because of the location and because of lifestyle and all that.
When you say lifestyle, what does that mean?
Okay, so of course, reproductive aspect of life, which, and then there's so infection go in through that.
Yeah.
And then it's very, sorry, the question again.
The gland susceptible to diseases. Why, it's easily attacked.
So
please correct me, but when it comes to men is mostly prostate that we hear.
Okay, so epidemiologically, around 30 men in, I think, 100,000. I don't want to give, but I think around there, men usually come up with prostate related problems. And what's susceptible is because the stromal cells, the squamous cells, the muscular cells, they are constantly dividing, but the growth, so that go overboard. So now, as a result of constant exocrine functions, the gland to increase in size. Okay, I didn't talk about the normal size. Usually it's around 15 to 30 grams. So with constant growth, sometimes the body will not be able to
the growth of the
gland. So you have neoplasia. We call it neoplasia. So they grow way faster and they don't stop, constantly dividing. So that's the prostate cancer, and that usually happens in the peripheral zones. Then for the benign prostatic hyperplasia, the stromal cells just keep, and the muscular, they just keep getting big and big and big. It's like you are gymming. So they just keep getting big and big and big, and then they start to press on the urine, on the urethra, and so people are not able to really urinate. So they start having symptoms that we call them lower urinary tract symptoms. Yeah, so I don't know.
So what is that? What prostate gland susceptible to diseases is because it has this ability to grow so much. It has like a let me use the layman language. It has like a possibilities that a big.
Not really like it has. So every cell is usually they have. I'm trying not to use. There's something that tells you stop growing at this point.
Okay.
You've reached a particular phase, and then it's time for you to split and give. It's like human beings; they grow to a certain age, they die, but before they die, they give birth. So, if, say, for example, now a man starts giving birth and giving birth and giving birth, people are like, what's wrong with this man?
Yeah.
You understand? So that's like neoplasia. But then you give birth to one person and then you train him really well, and it becomes a job. I think that's more like hyperplasia.
Okay.
Yeah,
Okay.
So.
Show break. When we come back, you talk to us about the early symptoms we should look out for when it comes to prostate diseases. Don't go anywhere.
Invicta 98.9 FM.
Invicta FM.
Stay with us. Invicta FM.
Gabatar muku da sabon jig na jaka. Yanzu fararen tufafinka za su yi haske da sheki da kuma kiyaye kashi 99.9 na kwayoyin cuta a farfajiya da sauran wurare. Kawai ka jika da jig na jaka.
Jolly Johnny akan titi ke magana. A yau za mu ga kyakkyawar sani da mutane suka yi wa Maggi Chicken Flavor. Na gaba karanto harufan celery.
S-E-A-L-A-R-R-I-E celery.
Haba mutumina, ka ce kawai ka sauya harufan zuwa salary. To ga damar karshe karanto mana harufan turmeric.
T-U-R-M-E-R-I-C. Turmeric.
Kin yi daidai, ga kwali ɗaya na Maggi Chicken Flavor ki ɗauka.
Maggi Chicken Flavor tare da albasa, celery da kuma turmeric mai canza wasa na.
Hey, everybody come outside, oh! It don't happen.
Hey, Cletus, why you dey shout like this?
Go TV don't bust my head, oh! You never hear say decoder plus antenna plus 1 month jolly subscription. Now only 15,000 naira.
You say?
Go TV don't scatter market with their World Cup special offer, oh!
Hey.
With only 15,000 naira, we go carry cha-cha decoder plus antenna plus 1 month subscription. Take torchlight the whole 104 matches for this FIFA World Cup 2026 with correct pidgin commentary. All this go happen live for 4 correct channels for Super Sport on Top Go TV.
Hey, this one no be small thing, oh! Make I go arrange my own decoder sharp.
Go TV. Love it.
Across Nigeria, MTN Foundation has impacted 600 plus communities with the What Can We Do Together initiative, inspiring a world where no community is left behind with better healthcare and science lab facilities. Nominate a primary healthcare center and a public secondary school for upgrade today. Visit www.mtn.ng/WCWDT or text MTN to 421. Nominations close June 8, 2026.
Lokacin jin daɗi sai Kivo Krima.
Idan na sha ko lokacin shan dari. Kivo.
Ki huta mama, yanzu na zan wanke maki fararen kayan nan naki.
To, amma ba wanke su kawai zaki ba. Ki tabbatar kin yi amfani da hypo domin yana cire duk wani takaddarin tabo yana kuma sa fararen kayana su ƙara haske kalkal.
Haka ne, kada ku amince da tabo, ku tabbatar farinku ya ƙara haske kalkal.
Ya ku masu ciniki, albishirinku gasar Maggi Chicken Flavor ya sake dawowa.
A sayi Maggi Chicken mai dunkule 2 kwaya 50 a samu garabasar guda 10 a kyauta.
Tabbas haka ne, idan kuma guda 10 aka saya, to za a samu garabasar guda 4 a kyauta.
Wato ƙarin ɗanɗano mai armashi, ƙarin nishaɗi, tare da more kuɗin ka yadda ya kamata.
A hanzarta maza a je shago mafi kusa domin sayan paketin kunshin gasar Maggi Chicken Flavor kafin ya ƙare. Gasar na nan har sai kayan sun ƙare. Da ni da Maggi, haɗuwa mai armashi.
Hasken rana in ya fito sabuwar rana ta bayyana ga uniform an shirya mana kuma ga mu akan hanyar zuwa Milo a cikin kofi mai ɗumi ga inganci an yi shi da malta Milo an yi shi da madara Milo an sa mishi koko Milo yanda dai ya kamata Milo mama ta ce in shanye
Milo
Mama ne masu kyau sun sani Dettol na tsaro kowace rana. Idan aka fito waje, neman arziki fa, kasuwanci kuma fa, yara na wasa a taɓo, amma ban damu ba. Awanni 12 na tsaro kowace rana.
Da amfani koyaushe, Dettol yana da sinadarin tsaro na tsawon awanni 12.
Sani Dettol na tsaro.
Dettol, sare iyalanku daga ƙwayoyin cututtuka sama da 100 domin su zauna cikin ƙoshin lafiya.
Dettol, be 100% sure.
Some business people sabi spend money. But smart business people sabi grow money. Why your cash could just sit down, they press phone for account? With Bill Station Fixed Deposit, put eligible funds to work and make plan for bigger business moves. The interest rate now 23%. 23%. Make you download the Bill Station app for Google Play Store or Apple Store. Bill Station, no let your money lazy.
Ga kwallon duniya na FIFA 2026 ya gabato. Ka duba duk gasa 104 a Star Times tun farkon kwallo har karshe.
Kuma a wannan kawo ba kallo kawai bane, ka kalla ka ci.
Kai subscribing ko ka sai Star Time decoder ka samu daman cin naira miliyan 10 da kuɗin lodi daga naira 4,000. Ku yi caji ta Star Times app ko ku ziyarci office ɗinmu ko dillalanmu a kasa baki ɗaya. Star Times.
Invicta FM.
You're listening to Your Health 360 right here on Invicta 98.9 FM, and we are still talking prostate diseases, catching early symptoms. We're on Facebook at Invicta FM 98.9 and on YouTube at Invicta FM 989 online TV. Program, the phone lines will be opened up for you to call in and for you to ask the doctor in the studio any question of your choice related to the topic. We have Dr. Aribi Shalom Joel in the studio. So, Dr. Joel, talk to me about the early symptoms men should look out for when it comes to prostate diseases.
Okay, so some of the early symptoms you find increased urinary frequency.
Okay.
Yeah.
What does that look like?
So you go to urinate like 8 times a day.
A day?
Yeah, like.
Is that not normal?
Not really.
Okay.
Yeah, for some people, of course.
A lot of water during the day.
Yeah.
And you urinate 8 times in the day, that means there's a problem. But if there was a high water intake, should we be worried?
There's a high index of suspicion when you notice you start urinating, and especially at night.
Okay.
Especially at night, we call it nocturia.
Yeah.
So at night you wake up to pee a lot, and then in addition to that, there's incomplete voiding. So you urinate, but you feel as if there's still something left inside. And then you go again, and then because of that, another symptom now, straining. So you strain to like bring out the urine because you feel like it's not coming out.
Yeah, there's that pump play.
Yeah. Then there's hesitancy. So you try, but it doesn't really come out like that. There's also dribbling of urine. So that dribbling now, it's not like you're dribbling playing football. Yeah, it's more the urine comes out like a shower. So it's most so the way I usually ask patients, say, so after you finish, when the urine comes out, how does the stream now? Like, does it come out very fast, or so that's another one on the stream. You pay attention to it. Does it come out like projectile?
Mm-hmm.
Yeah, like out. Yeah. And then it starts to
splash everywhere.
And then you also want to find out if it drips on their feet, maybe, or on their trousers. Yeah, it's easier to find out. So these are some of the symptoms that we have. Another is pain, lower pelvic pain. Yeah, when someone has prostate related problems, pelvic pain and back pain too sometimes. But most times, so basically symptoms related to obstruction, because the prostate now is increasing in size and the patency of the urethra is being compromised. So something is increasing pressure on the urethra. So you start having problems relating to that. And then now the thing is, for some people, things like diabetes can cause that increased frequency. Yeah. So when you come to the hospital, usually they will do some tests to rule that out. And then Also, if someone has lower urinary tract infection, it can also give you some of these symptoms. So there's also hematuria, that's blood in urine. So you see like your urine is bloody. Of course, there are also other conditions like schistosomiasis that can give you that bloody urine. That's like when schistosomia hematobium, that's it's a microorganism, a parasite that lodges in the urinary bladder. Yeah, and then some people too with cystitis can, but still, when you start seeing blood in your urine, blood in your semen, those are things that gives you cause for concern. Come to the hospital to get checked out. Basically, anything out of the normal that you are used to with that place, you should go to the hospital.
Yeah.
Because they're okay.
Go ahead.
Okay. Because usually people get scared. Anything that comes to the private parts, they don't really want to voice out their problems. So it's encouraged to go to the hospital as soon as you start noticing some of the symptoms that you're not used to having them before. And then some people have history, like family history, maybe your dad and your brother, like that,
grandfather,
yeah,
great
all those
grandfather.
things. So that's genetic predisposition for these conditions. And then usually from the ages of 40 years, that's when these symptoms start to manifest. Of course, for some people, even less than 35 years, but normally from 40 upwards. So, and I think about 50% of men, correct me if I'm wrong, from 40.
You should be correct.
Yeah. The risk of having these symptoms increases as you grow older as a man, because the prostate keeps getting bigger and bigger with size. So it's advisable from 40 upward.
Yeah.
You
should take it seriously, like do tests.
Do tests, come to the hospital, you get checked out, pay attention to what's going on down.
So a person who wants to make sure, like maybe they have noticed, they know genetic disposition to it, and they just want to keep in check, or any man listening to us wants to do health scans and other related stuff, tests, what that they need to be taken.
Okay, so usually when you come to the hospital, you see your doctor. He'll do an abdominal exam after taking the history, of course, to bring out some of these symptoms. And then the physical exams now, so that's where the abdominal exam will be. And then he'll do a digital rectal exam. So the digital rectal exam, DRE for short, it's not like they're going to carry a digital camera, but he's going to use his thumb or his foot in the books. Yeah, but mostly we use the fingers. So either index finger, there'll be a lubricant, a jelly kind of, so that it won't be painful for you, and then the hand will be put into the anus.
Yeah.
So it's done because you can easily reach the prostate through the anus.
Yeah.
So you feel for the prostate gland. You feel if you can go above it. There's a median sulcus, so you feel if you can go. You can feel the groove, you can go above it or not. Is it smooth and rubbery, or it's beginning to have nodules? So for benign prostatic hyperplasia, it's usually smooth and it's rubbery. And then, but yeah, sometimes your hand will not be able to go above it, depending on the size of its growth. And then for the prostatic cancer now, because remember we said it's the peripheral zones, the outer zones, so you begin to feel some sort of nodules that are irregular in size and all that. So when you start, when the doctor feels that, of course he'll send you for other tests. There's the prostate specific antigen test, mostly. So in BPH, again, you find out that the increase in the prostate specific antigen is somewhat synonymous. It goes hand in hand with the increased growth size of the prostate. But for prostate cancer, it's usually like haywire because of increased proliferation of cells like that. then there's also ultrasound scan. So you can do abdominal ultrasound scan. It's not really specific, but then it can give you an idea of the size of the prostate. However,
what kind of scan you do, or do you just go and say?
No, he'll start with the history, physical exam. So the physical exam now. Then now we're going to specific tests. So the prostate specific antigen, it's more like it's a blood test. Yeah. Then the scan now, there's also transurethral ultrasound scan. That's more specific for the prostate. Yeah. And then we have multiplanar MRI. That one too, it's very good. Then we have the prostate biopsy. So that one is more specific. That's what you take a sample of the prostate, you go and do histology, and then you see the different zones, the growth, and so it helps you differentiate. Okay, this sample is in this zone. This is what it looks like, and you can say for sure if this person has BPH or prostate cancer. Yeah.
Yeah. So if a man is experiencing any of those symptoms that you mentioned earlier, like increased urination, urinary incontinence, the projectile of their urination, and they sweep it aside as, oh, it's urine, there's nothing there, or their urination becomes painful, or they experience back pain and they assign it to stress or something else, they basically self-diagnose. What effect of ignoring those symptoms? What are the consequences?
Okay, so that brings us to complications. Eventually it becomes long-standing. You are growing older, the prostate is becoming larger.
Prostate diseases, like do they or that springs up on you immediately?
Okay, so and urine microscopy that determine infections that just requires an antibiotic, but it's at home. You can do it at home, but the urine MCS, it's urine microscopy, culture, and sensitivity. So basically everything is looked under the microscope, and then a culture medium is formed. Antibiotics are tested against the microorganisms that are grown to find out which antibiotic is more which antibiotic the microorganisms are more susceptible to, so you get treated and your symptoms resolve. But BPH or prostate cancer, usually symptoms for BPH is gradual, and the pain too is gradual. For prostate cancer, you start to notice weight loss, especially when there's metastasis. So, and then the earlier you catch it, the earlier you see a urologist that is dedicated to handling things like this. So the earlier are fixed. We have them in Kaduna here. Yeah, if you go to Barodico Teaching Hospital, you see one, and some of these hospitals to have visiting urologists that comes around. So when you go to your HMO, the doctor there will advise you or give you a referral form to see a urologist if he suspects you have this.
So you have symptom and not say, oh, it is this or that.
Yeah.
Hospital and lay symptoms, and the doctor knows what to do.
Yeah.
So you have to speak on complications, the long-term consequences.
Is used one of the commonest is blood obstruction. So you have remember the prostate is round, goes around the urethral meatus, but just outside the bladder. So when it starts to grow, it occludes the urethra.
It obstructs it.
Yeah, it reduces the lumen.
Okay.
Yeah. So you can't try to urinate, it doesn't come out because there's something blocking the lumen. It's no longer patent. So you keep urine inside, and it's a waste product. It needs to go out. So you keep it inside, the waste product starts giving you infections too.
Oh.
And then pain. It eventually becomes painful. Condition referred to as acute urinary retention. The that will result is when a urinary catheter is passed. There are different types, the Foley's, even the Foley has the one that's silicone type. Then there's another one, I've forgotten the name, but it has like a star-shaped, So, but star shaped is usually put suprapubic, so you can pass it. You can pass the catheter through the urethra, meatus. Of course, we also use lidocaine to make it not painful because the procedure you do it under aseptic techniques, and then the urine comes out. If you cannot do that other one for certain reasons, maybe you're seeing blood coming out through the urethra meatus, then you do a suprapubic catheter insertion. So you cut, say, like above the pubic symphysis. It's a bone, the bone you feel in front of you, just above your penis. So above it, like 4 centimeters above, they cut the catheter so to release your urine, and then they try to sort it out. So these things are painful. Nobody wants you being passed into him, especially when you go to the hospital, and obviously someone will have to do it. Yeah, so those are procedures. You don't really want that. I think it's better early. Symptoms are picked early. Nobody wants cancer. Everybody wants to have a good time. Some people can also get erectile dysfunction as a result of all these things, which many men do not want. It's just fun to go having the symptoms. Talk about things related to parts of the body like that.
We'll get the and break will open up the phone lines. I want to know how common prostate related problems are, and what are conceptions that would actually stop a man from going to the hospital to seek for help. Let's go to this commercial break. We'll be right back.
98.9 in Victor.
My first Hausa in-law visit, I nearly called 911 after one crush of Mr. Chef Cubes, and my me and cookers spoke fluently. Even the grumpy Auntie Amina asked for takeaway.
Savor the taste of culture with a 2-finger crush of Mr. Chef beef, dawa dawa, and mixed spices seasoning cubes. Mr. Chef, taste home, taste culture.
Chef of life.
Lokacin jin daɗi sai Kivo Krima.
Idan na sha ko lokacin shandari. Kivo.
Ga kwallon duniya na FIFA 2026 ya gabato. Ka duba duk gasa 104 a Star Times tun farkon kwallo har karshe.
Kuma a wannan kawo ba kallo bane, ka kalla ka ci.
Kai subscribing ko ka sai Star Time decoder ka samu daman cin naira miliyan 10 da kuɗin lodi daga naira 4,000. Ku yi caji ta Star Times app ko ku ziyarci ofis ɗinmu ko dillalanmu a kasa baki ɗaya. Star Times.
Across Nigeria, MTN Foundation has impacted 600 plus communities with the What Can We Do Together initiative, inspiring a world where no community is left behind with better healthcare and science lab facilities. Nominate a primary healthcare center and a public secondary school for upgrade today. Visit www.mtn.ng/WCWDT or text MTN to 421. Nominations close June 8, 2026.
Ya ku masu ciniki, albishirinku gasar Maggi Chicken Flavor ya sake dawowa.
A sayi Maggi Chicken mai dunkule biyu kwaya 50 a samu garabasar guda 10 a kyauta.
Tabbas haka ne, idan kuma guda 10 aka saya, to za a samu garabasar guda 4 a kyauta.
Wato ƙarin ɗanɗano mai armashi, ƙarin nishaɗi, tare da more kuɗin ka yadda ya kamata.
A hanzarta maza a je shago mafi kusa domin sayan paketin kunshin gasar Maggi Chicken Flavor kafin ya kare. Gasar na nan har sai kayan sun kare. Da ni da Maggi, haɗuwa mai armashi.
Mu tuna yadda mama take sammakon tashi da wuri ta shirya mana karin kumallo.
Lallai kuwa ya kamata mu mata wani abu muhimmi. Kyautata wa mahaifiyarka tare da biya mata kuɗin tafiya zuwa birnin Zanzibar a wannan shekarar 2026 a gasar Three Crowns Mom of the Year. Ka rubuta bayani ta amfani da kowace harafi na sunanta. Ka aika tare da hotunan hajojin Three Crowns na akalla naira 5,000 zuwa www.threecrown.com.ng ko cibiyoyin karban bayanai domin samun damar cin nasara a gasar. Akwai shirya da ka'idoji. Madarin Three Crowns. Lafiyar iyaye mata. Farin cikin iyali.
No be one, no be two, he plenty, it's not true. With Cocoa Glow, your skin they glow. Even tone, your shine they show. Aloe Soothe, for soft skin, dry skin repair, no dryness. Med extra hydration for strong moisture. Advanced repair, skin good as new. This is how we do.
Vaseline lotions, enriched with extracts, oils, and moisturizing glycerin. Choose the lotion that gets you.
Oh, you choose your own. Make your skin in the show. Vaseline lotions for you. Ooh, yeah, 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 yeah.
Beat, beat, beat. Emeka, I'm in trouble. The way the cost of everything is rising, I can't find a way to get these goods to my clients in Kano and Jos without losing my profit.
Musa, why are you doing this the hard way? You need a partner that understands the rising cost of getting by.
You mean someone who actually shows up?
Yes, I mean Prashal Express. I use them for everything. Packages, sensitive documents, even home deliveries. They are professional and they don't break the bank.
Do they go nationwide?
Nationwide? Lagos, Benin, Makurdi, you name it. Just give them a call. Big parcel, small package, value-add services like home delivery, Prashal Express and Logistics Limited is the one company for total reliability. Whether you're too busy to leave the office or worried about the rising cost, we are here for you.
Prashal Express, we deliver for you. Be rest assured, we are coming through. Find our main office at Shop FF18, Starcourt Shopping Plaza, Sabantisha, or our branch office at S20, Zara House, Amadou Bello Way, Kaduna. They've already picked up the goods. That was fast. You can call us on 0706 210 6674 or 0913 775 4873. Prashal Express and Logistics. Be rest assured.
Asken rana in ya fito sabuwar rana ta bayyana. Ga uniform an shirya mana kuma ga mu akan hanyar zuwa. Milo a cikin kofi, me dimi ga inganci. An yi shi da malta, Milo. An yi shi da madara, Milo. An sa mishi koko, Milo. Yanda dai ya kamata, Milo. Mama ta ce in shanye.
Hey, everybody come outside, oh! It don't happen. Hey,
Cletus, why you dey shout like this?
Go TV don't bust my head, oh! You never hear say decoder plus antenna plus 1 month jolly subscription. Now only 15,000 naira.
You say?
Go TV don't scatter market with their World Cup special offer, oh! With only 15,000 naira, we go carry cha-cha decoder plus antenna plus 1 month subscription. Take torchlight the whole 104 matches for this FIFA World Cup 2026 with correct pidgin commentary. All this go happen live for 4 correct channels for Super Sport on Top Go TV.
Hey, this one no be small thing, oh. Make I go arrange my own decoder sharp.
Go TV. Love it.
Customer don't enter shop. I don't see wetin he like.
Photo.
Body don't sweet am. But wallet he say, Oga, calm down. No wahala. With Bill Station Buy Now Pay Later, customer fit carry product today, pay small later. Business go sell more, customer go smile more. Make you download the Bill Station app for Google Play Store or Apple Store. Bill Station, buy am today, pay am small.
Nigeria has gone digital. Don't get left behind. Join millions already enjoying the benefits of digital television. With free TV, you get over 100 crystal clear channels for movies, sports, and news. All with zero monthly subscription. Just use any free-to-air decoder. Point your dish to Nigecomsat or stream live on the free TV NG mobile app. This message is from the National Broadcasting Commission. Don't wait for your signal to go off. Switch to digital TV today.
Mama ne masu kyau sun sani Dettol na tsaro kowace rana. Idan aka fito waje, neman arziki fa, kasuwanci kuma fa, yara na wasa a taɓo, amma ban damu ba. Awanni 12 na tsaro kowace rana.
Da amfani koyaushe, Dettol yana da sinadarin tsaro na tsawon awanni 12. Dettol, tsare iyalanku daga ƙwayoyin cututtuka sama da 100 domin su zauna cikin ƙoshin lafiya.
Dettol, be 100% sure.
Haba talle, ragin kudin yashi menene a duniya da baka neman ragi?
Akwai abu daya, wato tsarin tazarar haihuwa.
Ban gane ba.
Saboda shi kadai ne kyauta. Mado, duk lokacin da na je asibiti da iyalina dangane da tsarin tazarar haihuwa to kyauta ne, ko dai a caji kuɗi kalilan.
To ko shine dalilin lakabinka na tallatushen tattali?
Hakika ina iya taya komai, amma banda tsarin tazarar haihuwa.
Ikon Allah, ya dace ka sani a hanya.
Ba komai, sai mu fara daga ragin kuɗin yashin nan tukunna.
Ziyarci cibiyar lafiya mafi kusa domin farawa ko a kira lambar waya 222 wannan sako ne daga ma'aikatar lafiya tare da tallafin gamayyar kungiyoyin PROSTATE da FEM.
Kyautuwar iyali uba 'ya'ya da ma'uwa.
Mama, yanzu na zan wanke maki fararen kayan nan naki.
To, amma ba wanke su kawai zaki ba. Ki tabbatar kin yi amfani da hypo domin yana cire duk wani takaddarin tabo yana kuma sa fararen kayana su ƙara haske kalkal.
Haka ne, kada ku amince da tabo, ku tabbatar farinku ya ƙara haske kalkal.
Jolly Johnny akan titi ke magana. A yau za mu ga kyakkyawar sani da mutane suka yi wa Maggi cikin flavor. Na gaba karanto harufan celery.
S-E-A-L-A-R-R-I-E celery.
Haba mutumina, ka ce kawai ka sauya harufan zuwa salary. To ga damar karshe karanto mana harufan turmeric.
T-U-R-M-E-R-I-C. Turmeric.
Kin yi daidai, ga kwali ɗaya na Maggi cikin flavor ki ɗauka.
Maggi cikin flavor tare da albasa, celery da kuma turmeric mai canza wasa na.
Invicta FM.
And this is still your Health 360 right here on Invicta 98.9 FM. The 140,989 or 087 800 989 040,000 989 or 070-87-800-989. We are talking prostate diseases, and we have a caller here. Hello, good evening. Hello. Okay, just give me a moment. Hello, good evening. Okay, Ambassador Shamag, let's hear you. again. Can you ask your first question again? Okay.
Limitations. Because prostrate is a very people. People see sex as it's a sin. And we shouldn't see it as a sin. It's a duty that a man should have to keep his static. But if men are not having sex, technically I don't think it's right.
Okay, thank you so much. I think this should have led us into the cultural misconceptions. But Dr. Aribi, I hope you heard the questions that was asked, the relationship between sex and prostate diseases.
Okay, so yeah, a lot of people worry that not having enough sex
makes them susceptible.
So yeah, certain researchers have supported that theory and saying having more sex reduces your chances of that. It's true, but I have all or none statements to this. Yeah, but of course, the more you have sex, the more you ejaculate, the more. So it's kind of the frequency of whatever the exocrine glands, when they are full, they are being released. I think that's the science behind it, if we're looking at it literally. But yeah, I think I'll leave the ball to the urologist. I don't give out information that, yeah, but to frequent sex reduces the risk of prostate related.
So cultural misconceptions that people have around prostate diseases?
Okay, so most of the misconceptions, people believe that the prostate itself, I think, which ones have I heard now? So people feel like the prostate should not, they feel like prostate should not really be an issue, considering you are growing, most parts of the body atrophy, that they tend to shrink. The prostate disagrees with that. The prostate keeps on enlarging, and yeah, that maybe like this issue of sex now. Maybe my father was not
sexually active.
Yeah. And then most people try to get married on time. They use that to scare some men to get married on time. I think those are the ones I've heard for now. Yeah, but basically it's an exocrine gland. It does its job, and it's not something we should shy away from. People get embarrassed when they have problems related to that, because not everyone wants to go to a hospital and someone is a man, most especially, or it's exactly putting a hand into your anus.
Yeah,
it's not comfortable at all. And where that is a risk factor of erectile dysfunction. People are scared. Okay, what if I can no longer have sex? My wife is going to leave me, and all that. So there's a lot of apathy towards seeking health care. Yeah, there's poor healthcare seeking behavior in regards to that, and also the invasive catheter going into your body, tubes, you are seeing water. Sometimes, it's just people don't like it, and catheter is not comfortable. NG tubes are not comfortable. Like sticking needles is not comfortable. Nobody wants that. They fear hospitals. They fear Yeah.
Okay, so let's take this final call. Hello, good evening.
Not be natural. As long as they're having natural sex, I'm telling you, they don't come down prostate cancer anyhow. Clinically, I'm a medical person, so I want to advise that doctors should have emphasized on this. Let people that see, because I'm a child of God, sex is not my problem with your wife or whatever. We should do sex every week. Do sex once or twice or
Okay.
it helps.
Okay, thank you so much, Ambassador Shamag. Ambassador Shamag is calling back again to say that, sex is a must. And according to Dr. Aribe, it's like we shouldn't give the bulk of the reason why, prostate diseases exist just to sex, right? That's what you're saying. We shouldn't give the bulk of it to it. And what I'm getting also is with life, you can follow a particular manual or advice, or follow a particular health advice, and still things go haywire. You should still take yourself to the hospital whenever you encounter symptoms.
Yeah, sex does not prevent prostate cancer and
diseases. That is
and then
what
sex also predisposes you. Unprotected, not safe sex predisposes you to getting disease like gonorrhea, that can also give you prostatitis, and also increase the tendency of you having your lumen blocked, even if it's not prostate. So please let's balance. There's a place for balance.
And I was just thinking about it. A reason why a man wouldn't want to go to the hospital too is because if you say you have a prostate, if it's found that you have a prostate disease, or your genitals are having problem, it's like, oh, you're not doing what a man is meant to do, which is like show your sexual prowess. And I think that is a big misconception when it comes to the African society, because what makes a man really, when it comes to relationship, is that sexual prowess. Do you see that playing a role?
Yeah, so people don't want to show vulnerability, basically. This is a mental health awareness
June
month.
is men's mental health
So
awareness
shout out
month,
to all the men. You're doing great. So it's speak out, please. When you have an issue that you really need medical attention, go and see a doctor. The consultation room is just you and the doctor. If you want more privacy and you feel like the place is not private enough, you can talk to the doctor about it. He'll listen to you. The doctor is there for you, for your health, and you're paying for a service, obviously. Medicine is a calling, but the doctor gets paid. You're paying for a service. So, respectfully, you can ask for more privacy, or he or she will listen to you and try to give you the best care. I'm sure we have very good doctors in the state, in and out of the state, wherever you are listening from. I'm sure the doctors do try to do a very good job. So be open to your doctor, and I'm sure they will give you good advice.
And to the person that has been diagnosed of maybe a prostate disease or prostate cancer, what do you have to say to them?
So prostate cancer or prostatitis or benign BPH. It's not the end of the world. It's not something that is going to. Of course, there are mortality being that people die from diseases like prostate related problems, but other diseases also kills. Malaria kills plenty people a year. So people die from. I'm not saying malaria because malaria is cheap or not a serious disease, but people tend to trivialize malaria. Yeah, thank you very much. So, in as much as diseases like that people tend to trivialize, kill people, this one too does. But then early detection of symptoms, early
taking yourself to the hospital,
behaviors, they reduce. And then there are people that go on to live their lives, get healthy lives. You can get a surgery, worst case, you can get a surgery and you get better or not. That's why going to see a urologist, you sit down, there's something they call Gleason score for the prostate cancer severity ranking to determine what you need. So basically meet a professional, meet a urologist, you get better health care, you get better treatment, and you are better for it. Your family too gets to see you live longer and you enjoy your life. Thank you very much.
So much, Dr. Arabi Shalom Joel, for enlightening us today. Hope to have you back on the show some other time. And to you that listen, dear man, please take your health seriously. Your health determines the life you live. Okay, health is wealth. I've been your host, Chinwendu Perpetua Odimgbe, and to everybody that joined me on the Facebook and YouTube, thank you for joining. Ambassador Shemang, thank you for calling in on the show. This show makes a return, same time, same station, at exactly 8 p.m.
Your Health 360, only on Invicta 98.9 FM with Jacqueline Adedija.
We are the unbeatable station 98.9.
Oya shoppers, make una hear correct gist. Maggi chicken flavor promo don land o.
Buy Maggi chicken flavor 50 double cubes pack and get 10 extra cubes free.
Yes o, and if you buy small 10 double cubes pack, you go get 4 cubes free.
Na more rich chicken taste, more enjoyment, and more value for your money.
Rush go your nearest shop now and ask for Maggi chicken flavor promo pack before e finish. Offer valid while stocks last. Me and Maggi, so good together.